most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we have the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to show you how to unlock your hip flexors. We got 6 long-term fixes. They're self-treatment. I'm going to say right now, Brad, 3 of them involve no equipment whatsoever, and 3 of them involve equipment. So, you know, we're giving you both options. We're not saying by any means that you have to go out and buy this equipment.
Absolutely, but it can be helpful, and otherwise we wouldn't say you can use it.
Right, they're tools I use.
And those hip flexors, you know, that can lead to weak glutes, you know, as well as hamstring problems.
That lower cross syndrome, you know, where you get tight on one side and then weak on the other side.
Exactly.
So
you get weak glutes, your hamstrings start to give you problems, and then your low back. So it's a whole train of potential
what throws your whole
problems.
system off.
Right.
And even the head of the femur doesn't stay in a socket like it should when those are not working right.
Clunky.
I know, because this is a problem I've dealt with.
Say no more.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. And in case you're wondering why we're holding this, it's because if you go to bobandbrad.com, we're giving away this week a Booyah Stik.
Oh, that's right.
So there was somebody that was looking for a red one, I believe. Don't we sell red ones on our website?
Bob and Brad.
Yeah.
.com. That should be red there.
I told her that.
Oh,
she
really?
Said she didn't.
Well, we'll just have to check into it.
Otherwise, you can go to Facebook. It'll be pinned to the top of the page, the contest. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program. All right, tight hip flexors. That's very common because people sit a lot, Brad.
Right. So the hip flexors is a muscle group that's, I always tell people, when you put your hand in your pocket, at the high part of the pocket, they're in there, they're deep. And that's why they can be hard to stretch and hard to work with, but we'll show you some nice ways to do it. And they're responsible for lifting up your femur or flexing the hip. And if they get tight, then you're not allowed to go backwards, which is really important, particularly with walking or running and some other activities. So you want to keep your hip flexors flexible.
Right. And again, they tend to tighten up when you sit a lot. And who doesn't sit a lot nowadays? I mean, there's a lot of people that with their job and watching TV or watching
sitting in the car.
Yeah, sitting in the car. You're flexing all day long. So I mean, for most people, this is a stretches you need to do.
Yep. Okay, Bob, let's get into it.
All right. Which one do you want to do first?
Well, let's follow the instructions.
Okay.
I think we should start with the one on the knee. On the knee.
All right. So I do this one every morning. Did it this morning. I usually do throw a pad down or something. It's just a lot more comfortable.
On your knee.
On my knee. Yeah, right.
Yeah.
So
you'll see.
Yeah. So I'm going to stretch this hip flexor here.
The left one?
Yep, the left one. And I'm just going to keep good posture. I'm going to move forward like this. Now, some little idiosyncrasies here. I usually take my hand and I push the pelvis forward like this, just to give some stretching like this.
Now you can tell you've been stretching because this is a good extension of the hip.
Right.
See how vertical it is from his hip to his shoulder? Now, the tendency is for some people will naturally want to lean forward and do it
like this,
and that does not put as much stretch on. But
not on the hip flexor anyway. It might stretch the hip on this side a little bit, but the other thing I do is I actually take my foot and turn it out a little bit.
Right here,
just that internal rotation of the hip gives me a little more stretch too.
So he moved his foot towards you or the
camera.
Out
that way.
Yep.
Right.
That's one of those little things you don't have to do, but once you start stretching, I think you should add it in.
Right. So, obviously you want to do both sides.
Right. So you go pressure on, pressure off, or hold it for 30 seconds?
I usually do pressure on, pressure off because, especially when I put my hand on the pelvis, that works really well. Yep. Pressure on, pressure off. It's not unusual for me just to sit there too. Yep. I'll do a mix.
You get a feel for it.
You can see how your muscles respond.
Right, exactly.
The one that's tighter for me is this side. And this is the one that gives me more problems.
Right. Sure.
But it's completely under control. I mean, I've had episodes in the past, like 20 years ago, where I literally had to stop running for a month because it got so bad. But now I know what I'm doing. Yeah. Smart.
Hence the title, long term.
Right.
Okay, let's go to the next one.
You want me to do this one too?
Yeah, this one is laying on your bed. You can do this.
Or lying on your bed.
Oh, my goodness. I'm sure we had Yeah, we need the English majors are out there.
So you're gonna make sure you don't fall off the bed first. It's always safety first, but you're gonna bring this leg off the edge,
Yep.
and this one's gonna lock the pelvis.
There you go.
Now watch what happens to me. This just shows you. You know my hip is pretty flexible, but watch this. I bring it up and it comes up. So there's still some tightness there.
Right. If it wasn't tight, his knee would not move up towards
Right.
the ceiling.
You can see how I
yeah.
lock the pelvis. The pelvis gets locked back by this.
Yep.
You grab here. You grab underneath here. You can take a towel if you have trouble doing that.
And now the job on this one is just to completely relax and let
Yep.
gravity pull this leg down, which is going to stretch that hip flexor.
I also bend the knee a little bit, Brad, back. To get the quadricep.
Yeah, and that really works that
rectus femoris.
Yeah, that rectus femoris muscle.
Yep.
That's a biarticular muscle. It goes from the ASIS down to that patella.
Biarticular.
Biarticulate.
Wow,
Yeah, I did my
word.
homework last night, so I'm up to snuff.
You know, isn't there an old joke about rectum?
Bob, it's a family show. Let's
Damn near
carry
killed
on.
him. Rectum damn near killed him or something like that.
Let's carry on.
All right.
Ever since you turned 60, the filter's starting to leave. So you want to do both legs.
Right.
Obviously the tight one you can emphasize, but maybe they're both tight. Now, one thing you can do is if you want to have some tools to make this a little easier to do, maybe a little more effective and maybe a little faster, is if you warm up a
you
muscle.
forgot the strain counter strain, Brad.
Oh, I did. Didn't
I want to show that because I
Yep.
think this one is not so much a stretch, is it? It's
No.
as much as a pain reliever.
Right.
And I was surprised, Brad. This shocked me how this does help.
Sure.
So if you're having some discomfort in this area, you want to try this.
Yep.
And Brad's going to show this.
Or tightness.
Or tightness. Yeah.
So this one is the easiest one of all, by far.
Sure.
You're going to lay down in bed. If this is the hip that's involved, the right side, you're going to take the left. Did I say lie or lay or something?
You said lay.
Yeah. Left knee up. That's not being stretched, but that's a good place to put it. Now you're going to take the right knee. You're going to pull it like this.
You're working on the right knee right now.
Yeah, or on the right hip.
Right
hip. Pull it up, and we're looking for the most comfortable position you can. So you pull as far as it starts to feel comfortable. You're going to stop, and then you're going to rotate your foot right and left, and you'll find at one position it's more comfortable.
A lot more comfortable.
Yeah.
You want to find the spot that feels really good.
Yeah. And then you have to hold it at a relaxed position. Put a pillow under your head so you can completely relax and
Once
breathe.
you find that spot,
Yep.
then you go ahead and...
My fake pillow.
Yeah.
And you're going to hold it for 90 seconds. And you have to look at a clock. You're not going to guess at 90 seconds. You need at least 90 seconds. They've shown studies that that's important. Up to a minute or 2 minutes, 120 seconds. And once you do that, that allows that muscle to relax and get blood flow in it, which is going to help. And it does feel good when I do this. And then you're going to get up slowly. This isn't something you're going to get up and start doing that hip stretch and be aggressive. Then you're done. Give it a few minutes.
I would probably finish with this, wouldn't you? Maybe.
It all depends. I would try it and see how you respond to it. And that's the thing. We got 6 options here.
It might make the muscle more respond to the stretch, but sometimes stretch tightens it back up again too a little bit.
Yeah,
so it's
they
hard to
always
know.
say don't do anything real aggressive after this. Give it a 20-minute break or whatever. I would just.
I was again surprised. It bought me a couple days of I kind of forgot about it. It's like,
and that's exactly what we're
right.
For. Bob, we got to get going.
All
There's
right,
more
keep
things
going.
to look at. Okay, so that's the strain, counter strain. Now we're going to get into
using products here.
Right, using some extra, we'll call them modalities, if you will, in the therapy world. We're going to use some deep heat. Now, if you put a regular hot pack on your hip, it's never going to go to the hip flexor muscles.
No.
That's superficial heat, a standard hot pack that you buy off the shelf. If you get a infrared hot pack, like this one, it'll go, they've done studies, 2.36 inches, which is enough to get into that hip flexor. Unless you're a very large person, then that's not going to help. But if you're thinner, you will get into that. If you use this, and this is a Thermatex, this is the Platinum model. We do promote this because we really like it. We've used them for years. You're gonna.
I had it on my back last night.
Did ya?
I just leave it in my chair, and it's been cool enough now. Again, that
He's always got to get a word in. I'm
Right.
right in the middle of something here. Anyways, you got to put it over like this. Don't sit down and try to get it in
yeah,
there.
it just won't
It
penetrate.
won't do. You have to get flat so that it can get to the muscle, and leave it there for 20 minutes at least. Okay, it takes a little longer for these to get deep.
Yeah, it does. It takes a little bit to heat up,
Yep.
and that's where it's one that you want to do while you're doing relaxing and doing
Right.
something else.
Exactly.
Like I said before, I was rudely interrupted. I put it on my back every night when I'm watching TV. And,
Yeah.
I mean, you do too, quite often, right?
Right.
It's a treat. I mean,
Oh, yeah, yeah.
And sometimes I leave it on. I forget.
Yeah.
Even though that's not a problem because
Bob, this is the point where they say we're bad.
I know,
boys.
but I think this is a good point.
Okay.
I leave it on, and it's like it was like so warm already, right when I
Yeah.
got on it. And just okay, go
All
ahead.
right. So you could use this and then do your stretches. Heat that muscle out, get it more plastic.
Right,
if you will.
it'll respond better.
Exactly. The next one is you can get, a lot of people are buying these now, the massage gun. We like using a massage gun, the ones that reciprocate and pulsate and they get deep. On this one, I would probably we'll try the round-headed one. This gun, actually, we like it so much, we've got our name put on it, the
Yeah.
Bob and Brad massage gun. The quality is good enough. We said, let's promote it. And I'm going to get it moving.
We've been
here.
real happy with this company. We've been dealing with them for quite a long time. We didn't have a professional association. We just kind of, I had a loose association with them, and we decided to actually do some things with them because they do such a good job.
Can we go now?
Yeah, go ahead.
Okay. So I've got it going here. I've got it turned up on high. There's 6 adjustments on it, but you can see this. So your round one is what I think is going to work best. I'm going to get in here, and you can feel this get in deep. Okay. There we go. Ooh. And you're going to work it not on the bone, but into that muscle. You'll feel it.
You can go ahead.
Now I feel like doing this for a while, but I know we should quit. You're going to
You
do
said
that.
it never hurts, Brad. Though it should never hurt.
No, it
Yeah.
should not create any pain. Which,
For me, I do. This is what I do before I run.
oh, you do?
Yeah, and it hurts so good. It feels really good. Do you know what I mean?
And then when it's done, it feels
Yeah, even better.
yeah. There's a reason why people are buying these because they work
Yeah,
well.
they're awesome. I mean, they my wife uses it. I use it. I mean, you just pass it around.
Right.
So
Bob, do you want to show the next one, which is the
Massa-
6-inch roller?
Sure.
And this is one that you've done in the past.
yeah, this is similar to. I actually do both, Brad, believe it or not.
Oh,
In the morning.
you really work that.
I
hip.
really work that hip. So this one too has different intensities. You can go higher, higher, and higher.
So this is a vibrating 6-inch roller.
Yeah. Now this is, what can you say? This is a family show, but you do have to get on it like this. And I get right on the hip flexor, and I just roll back and forth like this. So it really does the same as the massage gun, Brad, to
Right.
a large extent. It's just
It's not as specific as you
it's
have.
not
that
as
point.
specific. And what I do is I hit the hip flexor, and then I go right into the hip abductor like this.
Oh, wow.
Like this. That probably doesn't show very
Yeah,
well. I'll go like this.
you don't have to show it, Bob.
Well, no, I'm like this. I hit the hip adductor, and then I go right to my hamstrings.
Oh, good.
See, and then I go to my
Do you do both at the same time?
yep.
or
I do
one
both at the same time,
Yeah.
and then I do
Your calf.
calves. And the reason I do both at the same time, these aren't problem areas.
Right,
For me.
right.
If it's a problem area, I focus on one at a time.
If you got a tight knot, you want to get rid of it.
Right.
Yeah.
So, and that's why the hip flexors I do singly,
Yeah, I get
and
it.
I roll right on them like that. That feels good right now.
I believe it.
That's pretty intense, but I have to, because this is loud and it sounds like a truck, I have to use it in the basement.
Oh, right. You don't want to wake your wife
Well,
up.
that's exactly right. If she's sleeping in because she had a long day, I just like, I mean, it really does. It sounds like a cement truck is pulled up in your yard.
Oh, up on the wooden floor.
Yeah. So, but it works well.
Yeah, well, good.
All right. Remember, Rad and I can fix just about anything.
Except for,
A broken heart.
there you go. Thank you.
If we could stretch the heart, we probably could fix it because we could unlock the heart. So.